A major concern that patients have when they're considering surgery in general, but especially facelift surgery, is worry about scarring. And I just want to address that because, as I express to my patients, I'm really not worried about it. It's always a consideration that we have, but we expect the average facelift incision to heal very well. So at the end of this clip, I'm going to show a couple examples of my actual patients who've had facelifts by me and explain why they look that way. They look like normal anatomy with very hard to see incisions, and the reason for that is because the face heals really well. It has, facial skin has a great blood supply, and it has a lot of what we call adnexal structures, which are structures within the skin like hair follicles, sebaceous glands, and sweat glands, which allow it to heal very well. Lastly, when we actually remove skin, we're not removing any skin in a facelift under any tension. So all of the tension will be on the SMAS layer or the underneath layer, so that there is really little to no tension on the skin. That also allows the ear to remain fairly horizontal, okay, not to have what's called a pixie ear, okay. When too much tension is placed on the earlobe, it's going to follow the line of tension, which is usually along the jawline, and you're going to see a pixie ear, and you're going to see the ear almost like horizontal or on its side. Other things that I look for when I look at facelift incisions are, was the incision placed in a relatively retrotragal area? The tragus is a piece of cartilage that's the shield of the ear canal. And we place the incision just on the edge of that, so it's very hard to see. If you place an incision in front of the tragus and too much tension is placed on the skin, the scar tends to migrate forward and tends to be more obvious. And so those are things that I look for. So the first 5 pictures that I'm going to show you are my patients that I've done facelifts for. The last patient is a patient that went to Costa Rica and had a surgery there. And I think you'll see the obvious difference. Okay. I show this in all my consultations to explain to people that, scarring is really, in many ways, the least of our concerns. And actually, when I discuss results and concerns that patients have, the actual facelift incisions are rarely things that people bring up with me. So just for your information. Okay, watch for a few more seconds and you'll see some examples. Thank you.